21-year-old boy with liver and spleen and hemolytic anemia chronic. Two of his younger brothers have died of the disease, and chronic hemolytic anemia, younger brothers had transfusion. So one of the possibilities has been put as thalassemia. Of course, even his electrophoresis has been done, and that shows a higher percentage of fetal hemoglobin and hemoglobin E. So it's a hemoglobin E beta thalassemia is what has been given as the diagnosis. So you can see the spleen when he took the camera from the abdomen where my probe was. It is much below the subcostal margin, and you can still see the spleen there. So you see, that is the spleen coming in. Okay. That's the spleen, which is quite enlarged, almost 7 centimeter. And now we look at the liver here. This is the liver here. Okay. As such, unremarkable. Let's see. Yeah, even when I put my probe here below the subcostal margin, we can still see the liver. Without his face, I hope. Yeah, we can still see the liver here. And I can show it there again. This area. You see, this is the liver and the diaphragm. So basically, my probe is here, and you can see the liver here. Okay. So again, below the subcostal margin, I think 3-4 centimeters below it. Now I'll show you the heart, how it is because of anemia. Because at 7 years of age, he has that was done, and of course he had a hemoglobin of low hemoglobin even at that time. In fact, they gave him a blood transfusion. In fact, he has received 2 blood transfusions in his 21-year-old existence. So it is not a thalassemia major, but it's a thalassemia intermedia, because already he has a higher level of HbF and HbE, and also chronic hemolysis, which has been continuing since his childhood till his 21-year-old existence. As you can see, the cardiac here there is some hypertrophy, but more of an eccentric dilatation as consistent with his chronic anemia status. And you can see that LA is also dilated, disproportionate to the aortic root, the aorta that is. So that again suggests a higher LVEDP, which is causing the LA to be dilated. Okay, so these are subtle signs of chronic congestive heart failure. And one can say HFpEF, heart failure with preserved ejection fraction. This is because of chronic anemia. So the main thing about this heart is heart failure with preserved ejection fraction due to chronic ventricular overload due to chronic anemia since childhood. And the liver and spleen is probably because of iron deposition due to chronic hemochromatosis, which could have happened due to blood transfusion, but here in this case it's only twice blood transfusion. So unlikely to be hemochromatosis related, it's most likely to be related to his chronic hemolytic anemia, where the spleen is working over time, taking up the destroyed RBCs. So that is the thing. Yeah. The parasternal axis, the aorta. Yeah, the aorta. These are fine. 3 valve cusps. That's it.